Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new TEAM therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda and Matt.
Hey, David.
Hi, David, and welcome to everyone who's listening from around this country, throughout the world, and throughout the galaxy. You're tuned in to the Feeling Good podcast, and this is episode 485. And since you've heard that beloved voice of Matt May, you may guess that this is an Ask David episode, and you would be correct. So, hi, Matt. Hi, David.
Hi.
Thanks, Rhonda.
Hi, Rhonda. Hi, Matt.
Hey, good to see you.
And I thought I would start with an endorsement that one of our team therapists who lives and works in Poland sent us about a podcast that we did a while ago, 464, and that was the podcast on hopelessness that you did with Mike Christensen, David. And this is from Philip, who wrote, "Thank you to both Mike and David for the podcast on hopelessness." Well, at the point he wrote this, he wrote, "I've only listened to about half of the podcasts. In my eyes, this podcast is one of the best. Thank you for letting us in on a piece of your personal life, Mike. This episode reminded me of how essential empathy is and how powerful it is to find the grain of truth, even in the most distorted thoughts. I really needed the reminder of how in team therapy, aligning with our good reasons for feeling the way we do allows us to truly connect with that part of ourselves. It's still a lesson I need to keep learning in my professional practice. Thank you again, Philip."
Well, thank you, Philip, and what a beautiful thought. And thank you, Mike Christensen, for what you shared, and also for the whole idea. And I think, Matt, you've been a kind of pioneer in crusading for this as well, is that the use of positive reframing and paradoxical techniques, even with patients who are suicidal. And as long as you know that they're in safety, that they're not about to kill themselves, so you have some freedom to work with them effectively, it's an absolutely mind-blowing and powerful advance in the treatment of people who are hopeless and struggling with suicidal urges.
Absolutely, yeah.
Yeah. Okay, well, let's jump into our first question for today. And this is also from a beloved team therapist, Joel. "Dear Dr. Burns, I've learned from you that the foundational principle of cognitive behavioral therapy is that our emotions and ultimately our behaviors are rooted in thoughts or beliefs. Are there emotional and or behavioral disorders, perhaps like schizophrenia, that are rooted in abnormal neurobiological brain pathologies rather than in distorted cognitions or self-defeating beliefs? And if so, is TEAM CBT relevant to helping those suffering from these psychoses? With much gratitude, respect, and affection, Joel."
Thank you, Joel. And I'll give a quick answer, and then you guys can give something more substantive. But my heart goes out to anyone who's listening who has a family member or loved one who's struggling with schizophrenia. It's a truly horrible brain abnormality, and it absolutely is caused by, we don't know the cause, but we know that there's some profound abnormality in the architecture of the human brain, and someday we will know the cause of schizophrenia and hopefully have far more effective treatments. But as of this day, we don't know. It's just that it's very tragic and bizarre, and it's not a part of normal brain functioning. What could we offer? Well, we could offer two things. Because at my program in Philadelphia, we had a large cognitive therapy program at what was then Presbyterian University of Pennsylvania Medical Center, and we had a huge program that we developed for the people in the community that we served. It was an economically disadvantaged part of Philadelphia with a lot of gang warfare and a lot of suffering and few resources. But we did work with many people with schizophrenia, and the goal was not to cure the schizophrenia, because you can't do that with cognitive therapy, and we don't know any way that I'm aware of to cure schizophrenia. But you can make life much better for someone with schizophrenia, both through the cognitive therapy techniques like the daily mood log, and help them change their distorted thoughts, not the hallucinations, but the things they want help with that may be causing them to feel depressed, so that they can feel happier and have better relationships with others. Won't make the schizophrenia disappear, but will certainly add to the well-being of the person. And then secondly, if you have a family member who's struggling with schizophrenia, or any other, thing that, I know a woman who had many healthy and beautiful children, and then sadly one of her children developed a horrific encephalitis, viral encephalitis, that caused tremendous brain damage, and now the child can't really function independently, or really even hardly talk, and has caused tremendous distress, of course, for this woman and for her family, and she's been heroic about it. But you could maybe fill out your own daily mood log with your own thoughts about the schizophrenia of your child, and what is it about that's the most upsetting to you, and if you might find some distortions there. And then another thing is you can learn to use the 5 secrets of effective communication to communicate far better with someone with schizophrenia. So when they make a statement that sounds bizarre or psychotic, and totally off base, like I know they might say, I know you're plotting against me with the FBI, and there's a conspiracy. To find the truth in that statement, like the person's really telling you that you're making them feel untrustworthy and anxious around you, and you can acknowledge that and find the truth in that, and really improve the way you communicate with someone with schizophrenia. Again, it's not going to cure them or erase this horrible bad hand you've been dealt by the universe, this horrible, tragic insult to a child or a parent or someone who you love. But you can do a lot to change the way you think, and to change the way you feel, and to change the way you interact with them. And I'm sure that you, Rhonda, and Matt share my dream and prayer that one of these days someone will announce the cause of schizophrenia, and that will lead to radical new directions in therapeutics.
Yeah, thank you, David. That was beautifully stated. Yeah, I think that there are some theories that we have around the cause of schizophrenia that hold some water. There's one that this process that all brains go through around the end of the teen years called pruning, where certain neurons are removed, that process somehow goes astray for folks who have schizophrenia or who develop schizophrenia. And it tends to be around that age, in the late teen years when people first develop symptoms of schizophrenia. And we don't have specific CBT or TEAM methods to address the symptoms of schizophrenia, like paranoia, for example. But we would say that, there are medications that can help those symptoms quite a bit. And part of the challenge is that patients don't want to stay on those medications. They also feel, like David was alluding to, scared of their providers. And so empathy is one of the most important things that you can offer to create a trusting relationship, so that you can offer the medications and the information about medications that can directly help with the psychotic symptoms. And then also keep in mind that people with schizophrenia have all the other problems that everyone else does in life too. They'll have, depression, they'll have relationship problems, and team therapy can help with those parts of their suffering, and in the ways that we've described elsewhere. I've occasionally seen paradoxical techniques work to some extent on paranoia, where I would argue that, it just doesn't seem like this could be a coincidence, what has happened, and it must be some type of, group that's against you. And when people can argue back against that and say, well, maybe it actually was a coincidence that this stuff happened, they actually do feel somewhat better sometimes. But I would say the power of that is pretty weak, and the medications are pretty necessary.
I was corresponding for years with a fellow with a schizoaffective disorder, I guess a combination of bipolar and schizophrenia. And he was taking massive amounts of Haldol, and he was in and out of the hospital all the time, and I was sad for him because he's in his 60s and has had, he has marginal money to spend, and it's hard for him to mix with women, to date, to do all the normal things. But he sent me an email about 2 or 3 weeks ago that they took him off Haldol and put him on some new, I think, or a different neuroleptic. And he said it just has been like magically effective, and he's just been doing really well for 2 or 3 months now. I don't know which one it was. I could probably look it up in my Microsoft Outlook and even find the name of it. Should I try to do that? And I can ask you if you know anything about the drug, Matt?
You could if you wanted to. It's not really my area of expertise anymore. I do know that medications like olanzapine, which is also Zyprexa, showed a lot higher efficacy than some of the typical antipsychotics like Paradol.
What's the trade name of olanzapine?
Zyprexa.
What is it?
Zyprexa, Zypre.
Oh, Zyprexa. Okay. Well, I'll just look this up for my own curiosity here. See if I can find this, but I'll let you guys push on to something.
Well, it sounds like what you're saying is that when someone has schizophrenia, CBT is not going to help them be cured of the schizophrenia, but TEAM CBT could help support them with their thoughts that are around medication compliance, or it could help them with their coping skills and their day-to-day functioning, or maybe reduce their distress or help them build social relationships and social skills, like the things that everyone in the world are already dealing with, whether they have schizophrenia or not. Yeah.
That's exactly right. That's a great summary.
Okay, well, thank you. Okay, let's go back to the next question, which is very brief. And she says, "Dear Dr. Burns, I'm curious."
Wait. Here's what it says. I do have some earth-shattering news. This was on September 15th. On June 28th, I was put on a new drug, Zyprexa, with a great reduction in Haldol, and this has turned out to be a godsend and changed my life completely for the better. So that was just, so that's one of the ones you mentioned, right, Matt?
Yeah, I think a lucky guess, but there's also some data that that's a particularly effective medication.
Yeah. So maybe, there are some advances all the time, and drug companies are always looking for something, even from a commercial point of view, because if they could come up with something more effective, they're certainly going to be rewarded financially.
Yeah, exactly. I mean, one thing to be aware of too is these medications have side effects, and you don't want to just get on one without talking to your doctor.
Yeah.
Zyprexa in particular has problems with weight gain and insulin, basically something that looks like diabetes. And so you want to be monitoring for that pretty carefully.
All right. So let's push ahead here.
Okay. Dear Dr. Burns, I'm curious if you have thoughts about the problem of talking back to the obsessive thoughts in obsessive compulsive disorder in patients who are suffering from obsessive compulsive disorder.
And didn't you have an embellishment on this, Rhonda?
I did. I asked for an example, and so the example was, my hands might be contaminated. And then more thoughts about this question are, the problem with traditional cognitive methods with obsessive compulsive disorder is that talking back to an obsessive thought can become another compulsion. I'm imagining that David might say then we should use exposure or response prevention or the hidden emotion. But I'm curious what he would have to say about talking back to an obsessive thought.
Right. Well, I have some thoughts about this, that I don't so much focus on what method would I use for some thought. I don't attack symptoms or diagnoses with methods. I use TEAM CBT, and measure things at the start of the session. See if I can get an A on empathy with the person, and then do the paradoxical agenda setting. And then if the person really does want help, what was this person's thought, Rhonda?
My hands might be contaminated.
Yeah, contamination phobia, germ phobia. And then if that were the thought they want to work on first, I'd put it in a recovery circle and select at least 10 or 15 or 20 or 25 techniques to challenge that thought. And I would always use the same four approaches. The motivational approach, dealing with outcome and process resistance. The cognitive approach, which is what we're talking about at this instant. The exposure technique and the hidden emotion technique. And it is simply not the case that challenging an obsessive thought with cognitive techniques will not be helpful. That's just kind of horseshit in the extreme, and it can be very helpful. One of the women who was foundational in the development of the Palo Alto University, I remember her saying that for her, I don't know if it's her PhD or her PsyD research, she compared cognitive techniques with exposure, to, purified, two purified approaches to see which was effective, and they were actually equally effective. But if we have the thought, my hands might be contaminated, I thought it might be fun to talk about, see if we could come up with a list here in 2 or 3 minutes of or less of 15 or 20 techniques to challenge that thought using these 4 approaches. Would you guys be up for that at all?
Sure.
Yeah, that sounds good.
Why not?
Well, I'll kick it off, and I'm going to and write these down. But this would ordinarily be on your recovery circle. But we would always want to start out with, of course, empathy, and then paradoxical agenda setting would be the first 2 with the positive reframing and all of that, and see if they're willing to use exposure and show what that thought shows about them and their core values that's positive and awesome, and how that thought might be helping them. And then purely cognitive techniques would be, identify the distortions, explain the distortions, the downward arrow technique, which could be the individual downward arrow, or the what if technique. And if that brings to certain core beliefs, we could work on changing those core self-defeating beliefs. We could also work on confronting the worst fear with, cognitive flooding. And we could think in terms of the experimental technique, and we could think in terms of the double standard technique, and we can also think in terms of examine the
evidence.
The evidence, yes. And then what do you think would happen if your hands got contaminated? Well, then I might touch my children. I had a patient who said that exact thing. And then what would happen? Well, then my children will get contaminated, and then what? Then my children will die of leukemia. And then what was her hidden emotion, Rhonda?
What was her hidden emotion when she was worried that her children would die?
If her hands got contaminated and she didn't wash them 50 times a day,
she was afraid that she would cause them to die.
Yeah, but now is that a hidden emotion or an anti-hidden emotion?
I think that's a blatant emotion.
Yeah, exactly. But I was asking about the hidden
emotion. Maybe she's angry at them and wants them to go away, and there are moments she would like them to be away from her.
That's exactly what was going on. And so why doesn't she just express those feelings? Why does she have to leak them out indirectly through OCD?
Because they're not socially acceptable and they're shameful. And she's judging herself for being a bad mother.
Right. And what is the cause of all OCD in the United States at this time? The Buddha wrote about it 2,500 years ago. His chapter on he had a chapter in the Tibetan Book of the Dead called OCD in California.
I'm bunting that to Matt.
So is it excessive niceness?
Yeah, exactly. Exactly. She's not allowed to have negative feelings, and that's the cause of her OCD. Any other techniques that you guys want to add to that list?
I wrote down paradoxical magnification. And I'm not sure if we talked enough about just the in vivo flooding and experiential, learning that you can have all kinds of nasty stuff on your hands and you don't actually get sick. Yeah.
So that'd be cool. You know who's the best at paradoxical magnification in the whole world by far?
No, who's that?
Our Feeling Great app.
Uh-huh.
Oh, you're kidding! Really?
Yeah, it is a genius at that. It'll have you rolling over on the floor in laughter. It's just so fantastic. But yeah, paradoxical magnification. What are some other techniques? I think we've got 13 or 14 so far. My hands might be contaminated.
Well, I'm sorry, I might have spaced out, but you said cognitive flooding, but what if it's like blatant exposure where you just shove your hands, and maybe this is an experiment, but like you did with Sarah in the Tuesday group, where you just shove your hands in the toilet in a bin of garbage and see what happens next.
Yeah, that exactly. You could let your hands get contaminated in reality, and that like with Sarah, that's fantastic, Rhonda. What are some other techniques? Let's say we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
I was wondering about just having scheduled worry breaks.
Could
be good. Did we bring up response prevention or self-monitoring?
No. Response prevention. Tell us how those would work. Worry breaks and response prevention.
So a worry break is a time of day that you just have a timer go off, and for those 10, 15 minutes or so, you deliberately try to amplify feelings of anxiety and worry. Focus on images that are disturbing in your mind, or repeat certain thoughts that are upsetting in your mind. And the idea is to kind of surrender and allow the anxious feelings to wash over you, and even to kind of invite them in, like they're your friends there to the important lessons. And then the rest of the day, you've got your activities scheduled, and anytime your anxiety starts to knock and try to intrude into your mind, you take control just by ignoring it, like a kind of a nuisance neighbor who comes over and knocks on your door when you're busy. You just ignore them and go bring your attention back to whatever you were doing. And you might make a mark on a sheet of paper to kind of observe and track how frequently that happens, or use a golf counter. And you remind yourself, I'm not going to talk to anxiety on its terms, but when my worry break comes up, I'm going to go over to anxiety's house and knock loudly and go down to the gates of hell and explore. But you don't give anxiety the power in the relationship.
Yeah. How about response prevention? How would that work, Matt?
Just simply not engaging in the hand washing. I understand that this person is probably, and you see it a lot with people with OCD, they will wash their hands until their hands are cracking and bleeding, and they know that that's unnecessary, but they feel just compelled to do it, and it feels really awful not to. They get the relief when they wash their hands, but if they're willing to pay the price of not doing that, just refusing to wash their hands or limit it to a certain number of times per day, then the feelings, although they intensify first, the anxiety goes way up first. If they're really regimented about not doing it, about refusing to respond to the anxious thoughts, then over time that anxiety comes down.
Yeah, that's great. That's beautiful. I just added 2 more shame attacking exercises and reattribution. Like you could just make your hands all like totally grimy and then walk around the mall, saying, "Oh, look at my contaminated hands. They're really just covered with germs and dirt and grime." And then along with worry breaks, you can use reattribution. That was that fellow from L.A., that psychiatrist who did that brain imaging before and after. Who?
Jeff Schwartz.
Yeah, Jeff Schwartz. And he what he did was just reattribution. You just say, oh, there's that OCD thought again. And instead of reacting to it, how would you use the experimental technique? Either of you, Rhonda or Matt, for this thought. My hands might be contaminated.
I'm drawing a blank on that one. Rhonda, do you have an idea?
Well, wouldn't it be something, my hands might be contaminated and then I will hurt someone?
Yeah, and then they'll die.
And they'll die. This might take some courage, but they would contaminate their hands, like putting them in the toilet, and then have someone's permission in advance, a friend or a family member that's willing to work with them. And then they could touch that person. Maybe they could touch that person's hand or face or some place that's an exposed skin. Not in an abusive way, but just touch them and then notice if they die.
Yeah. Or you can make it more extreme. Just put your hands in, say, a grimy trash bin, get them all covered with grime, and then see how many people you can kill in the mall. There was this British guy. I've probably told this story. I'm so elderly and demented. I'm going to tell this story every time now because I'm so demented. I won't even be able to remember that from week to week. But I went to this lecture of some guy from Britain. He was the top OCD man in the world at the time. He was a little ahead of FOA, but he was the king of the roost. And he gave a talk at the American Psychiatric Association, a half-day workshop, and he got up and said, I'm going to tell you everything you need to know about the treatment of OCD. Exposure always works, and everything else always fails. And so that's the only thing worth doing. That's the end of my presentation. Are there any questions?
What arrogance.
but at any rate,
confidence.
But I thought it was good. Yeah, cool. Well, yeah, it was kind of irritating too because he had no idea what the hidden emotion model was or anything. But he was good at what he did, and he said that he was treating this man with OCD who had taken seriously, if you step on a crack, you're going to break your mother's back. And he was just terrified of ever stepping on a crack and went greatly, spent a great deal of energy avoiding cracks. And so the treatment is they took him to a high school gymnasium, which is all these, boards, wood flooring with strips of wood. So there's cracks, this entire whole room full of cracks. So they told him, go in there and start stomping on the cracks. And the guy was just terrified and he was dizzy and he almost fell over. And they told him, keep stomping on those cracks. And then he got an emergency call. And apparently an uncle of his had suddenly died. And then he said to the audience, now, if you were the psychiatrist, what would you do next? Any ideas, guys?
Continue jumping up and down on the crack.
Yeah, have him continue walking.
Yeah. Well, he had to come out, and go in a phone booth. It was before cell phones, and he got this emergency call or something and got this information, and he was just shocked. And then the psychiatrist told him, "Okay, now get back in the gymnasium and see if you can kill another one or two."
Right.
So, but anyway, I thought that was pretty cool. But these are some, would be a beautiful panorama of techniques for working with such a person. We didn't bring all of these techniques to life.
There are a couple others.
Oh, and I forgot the big one: externalization of voices.
That's a big one. If it's a hidden emotion of anger too, just the 5 secrets and learning how to do self.
Oh yeah. Five secrets. That's great. Yeah, beautiful.
The interpersonal downward arrow might help uncover some.
Oh yes, the interpersonal downward arrow. That's a cool one. The rules and the roles and the rules. And so the reason I got angry about the question, Rhonda, can you see why now?
Yes.
And why?
Because for several reasons. We've talked about this before, and it's not that we're treating this theoretical idea of thought in OCD. We're treating this particular person, and we're coming up with a long list of all of the options that we could try, with the idea that we're going to fail as fast as we can and try one technique. And if that doesn't work, we've made this recovery circle. We'll go to the next one, and we'll keep finding what it is that could work with this particular person and this particular set of thoughts that they have.
Yeah, and all of these techniques are powerful and mind-blowing, and we're not being some wimpy therapist who's, challenge that negative thought over and over again. Well, I don't know any dopey therapists. Well, I do know a lot of dopey therapists, but even the ones I know that are dopey, they're not that dopey to just do some stupid thing like that, challenging the negative thought over and over again. These are powerful, sophisticated techniques, and they usually have a pretty high success rate.
Great, yeah.
Okay, we have time for one more question, Rhonda?
I think we do.
Okay.
Okay.
Was that answered okay, Rhonda?
I do. I think so. What do you think?
We crushed it. Yeah.
Yeah, I think we crushed it. Okay. Dear Dr. Burns, when someone has objectively hurt you, like your partner has had an affair, for example, how do you get over that pain? I'm not having thoughts that I did anything wrong or there's something the matter with me. I feel sad, hurt, confused, and angry. Jim.
So I feel sad, hurt, what else? Angry.
Confused and angry.
Yeah. And confused, and wants to know how to get over those feelings.
Well, no, they're saying they just legitimately feel sad, hurt, confused, and angry. They're not having any thoughts that they've done something wrong or there's something the matter with them. They're just having these feelings. And how do they get over the painful feelings?
Yeah. Well, fortunately, there's a very amazing and crisp and clear answer to that. And my colleagues, Rhonda and Matt, will now provide that amazing, mind-boggling answer.
Okay, I'm going to jump in first, Matt. My answer is you don't get over them. Now, we've talked before about there are appropriate times to have feelings and inappropriate times. I'm not sure if the correct word is appropriate, but if you found out that your partner has had an affair and you have an agreement to monogamy and they violated your agreement, and it is legitimately reasonable to feel sad, hurt, confused, and angry, especially if there are no distorted thoughts that you're having with them, and just allow yourself to feel them. That's the appropriate thing to do.
Okay, there's a beautiful, a great start and well stated, Rhonda. Matt, what is your contribution to this common issue? I have a feeling that you will have some strong responses to this, Matt.
Yeah, thank you. It's well, first of all, I like Rhonda's response of just being not to see your feelings as the enemy, but to acknowledge the feelings, allow yourself to have the feelings. And I think the whole team model could apply to be helpful. To do some measurement to see how intense those feelings are of sadness and hurt and anger, just as a benchmark for going forward. And then we would, do agenda setting, empathy, agenda setting, and there'd be many methods that we could help someone feel better in that situation if they wanted that help. I think we'd have to get like a bit more specific about what type of help they were looking for. What would that look like? Would they want to feel less angry? Would they want to feel less hurt or less sad or something else?
I love that.
Yeah.
I love that, Matt.
Yeah, absolutely. That's great. I'll add another piece or two. One would be, Rhonda, you're making the assumption that they don't have any distorted thoughts. But since our assumptions are virtually always incorrect, how could we find out if they're having any distorted thoughts?
We could be curious and ask them.
Yeah, like what are you thinking? What are you telling yourself? And are you having any thoughts that are really upsetting you? And and there might not be, but there might, and maybe saying, well, I'm not sexy enough, I'm not cool enough, that type of thing. I had a girlfriend. That was the word we used in those days, and some people still use it. But my first year in medical school, and then I found out that she was really not being very faithful at all, and I think we were just at a different place of our life. I was very idealistic, and I think she was just into, wanting to be really, really wild. And I went to a psychodrama marathon, and it came up during the marathon. I was very hurt and angry and confused, and she was not with me in the marathon, as an aside. And this older woman came up and said, "David, it's time for you to dump her." And I did, and it was kind of really, really liberating, and maybe rethink your priorities and how you're going about dating and stuff. And then I decided that maybe I needed to go through my own, wild phase as well. Maybe I was too much of a goodie, and so I kind of radically changed my whole life, and it was a fantastic adventure. It's what I wrote about in my book, Intimate Connections, and but it was kind of sad too, not only for me at the time, but I think eventually for her, because I went off in another direction and found all kinds of happiness and love and sexuality and fabulous wild times that were beyond anything I'd ever dreamed about. And I'm not sure that things worked out as well for her, but we were completely decathected at that time, and ever since. And I had just made the decision go in another direction, and she kind of got left behind, I'm afraid, to a certain extent. And her wild adventures weren't always what she hoped they would be.
It's interesting.
Yeah, I don't know if it's making any sense. What?
I thought that was a useful story.
Yeah, me too.
This person's going through heartbreak, and I feel for them. I was imagining, in fact, if they're feeling angry, that there would be a distorted thought behind that, and it could be something as simple as a should statement, like, she should not have hurt me.
Mm-hmm. Yeah. And maybe I need to learn more about men and how to control men, rather than letting them screw me over. And those are skills that any woman can fairly easily learn. Mm-hmm. But it's something you have to learn and give yourself permission to have gotten screwed over. I've been screwed over a lot of times in my life in many different dimensions. And I think part of being idealistic and believing in things makes life more exciting, but you also leave yourself vulnerable to some con artist blowing smoke in your face and then screwing you over. And that's happened to me plenty of times. And it was shocking and painful every time. But I've learned a lot. And my wife has learned a lot too. And And now we're extremely good at picking up on who a con man is, a con artist, con man or con woman. It's like a sixth sense that you develop over time. And some people have it and most people don't. But it's something you can learn, is how to find people you can trust.
It's like a useful form of paranoia.
Yeah, that's right.
Yeah, a heightened intuition.
Yeah. Some people are just a little too slick.
And then
some people think that I'm that way.
Obvious.
Huh?
And then if you start to see where their motives are, where they're trying to take you and what they're trying to get you to do, you have.
People think that you're that way? I'm sorry, Matt, I interrupted you.
Oh, no, that's fine. People think David is slick. Is that
what you said, David?
Oh yeah. I get attacked by that a lot because people don't understand how team works, and they can't believe two things, well, many things that I say that people get pissed off at, and they write me off, and I'm trying to address some of those things now in the app and Q&A in the app, but when I talk about that many people with depression and anxiety can recover now rapidly, I'm talking about in a 2-hour therapy session. And even somebody, a newcomer to the Tuesday group, expressed in the feedback, you might have seen, Rhonda, kind of indignance about that. And how could David say something as stupid as that?
Yeah.
And it really pisses me off. I say, by the way, I published my work. Maybe you ought to start listening to some of the trauma patients, like the session that you and I did with Marilyn Coffey a few days after she discovered she had final, terminal lung cancer, untreatable, stage 4 lung cancer. And she just was helped so much in that single, roughly a 2-hour therapy session. It's all published there. Go listen to it, asshole dude, and and write a critique for the Tuesday group and talk about how David and Matt got this dramatic, total elimination of symptoms with a woman whose symptoms, everything was over 100 on the 0 to 100 scale at the start of the session. She was terrified, enraged, ashamed, anxious, hopeless. Anything you can imagine, she had it 100%. But at any rate, people, when I mention things like that, another thing for me, I don't know if you've had this experience, Matt, I haven't asked you, but when I'm working with somebody, it might be a 2-hour session, but the recovery generally comes at a certain moment in the session when we're doing externalization of voices, and they suddenly see how to talk back to the thought, and their belief in the negative thought suddenly goes down to 0.
Exactly. It's like it happens in the moment that their belief system changes and they see something new.
Yeah.
That happened just yesterday in a patient. His scores went from moderate range on everything, but very high levels of anger. And then at the end of the session, that was all gone. And it was because he just saw it. It was a flash. Oh, I've been causing the problem. And I've been, blaming and pointing the finger, but it's actually been something I've been doing. That's causing this.
Yeah. It's amazing. But when I say that at a certain point, and I say the moment she suddenly saw that her negative thought was wrong, she stopped believing it, and her negative feelings vanished. And people, they get ruthlessly after me for that. Say, everyone knows this is impossible, and you just lost your credibility with us. That type of thing. People are such know-it-alls. They think they know things that they don't. And being old and cranky now, I'm giving myself permission to say it. You suck. But at any rate, that's something I'm, we're doing a lot of beta testing with the new version of the Feeling Great app. So we're trying to erase, expressions that offend people. And it's been amazing to me when I have beta testers, going down, examining every word in some of the scripture writing and getting great umbrage. Sometimes just the way you express something, it's been quite eye-opening.
Just a quick comment on that. I mean, I think skepticism is good, and if you haven't seen rapid recovery before, I think it's kind of normal to be skeptical. But then, what do you do with that skepticism?
Yeah,
that you look at data. Let's look at the actual data before and after session for people who are treated in team therapy. And I've gotten to the point now where I'm surprised if there isn't radical recovery in 2 hours. I start to.
Oh yes, right. I know exactly really what you mean.
Okay, what was missing, and to go through the feedback and try to figure it out. But yeah, it's gotten to the point now where I'm more used to the rapid recovery than not, and it's present in the data. So just if you don't believe what David is saying, look at data.
Yeah, thank you, Matt. Yeah. Well, anyway, that was kind of got off on a tangent there, but as you know, I live on tangents and live in the weeds. So.
Well, the question that came up about the person having an affair, I just had one other quick thing on that, and then I have to go in like 5 minutes. But
Okay, so we'll draw to close here. Yeah.
Yeah, I think what they're going through is basically a kind of grief that they're losing their partner, right? They've lost the relationship and the trust there. And oftentimes anger comes in to kind of protect us in a way. Even from grief, to like anger is sort of like our demand that this not be the case. And so that's one of the advantages of feeling angry. And there would be many other advantages to feeling angry that we could look at in the outcome resistance. If they wanted to work on the thought, she objectively hurt me and shouldn't have, and the anger, we could look at, well, how is this anger serving you? And I think in a way it's trying to protect or demand the past back and to get their partner back, and not to accept reality on its terms, and then realizing that type of resistance, bringing it to the surface, can be really helpful to ultimately let some of the anger go and grieve more completely, and then move on.
Beautiful.
Yeah, beautiful. Thank you for today, Rhonda. Beautiful and brilliant Rhonda, and handsome and brilliant Matt.
Tell me more.
It was just so much fun hanging out with you and with the people who sent in these questions.
Thank you to everyone.
It's spending time with you both. Thank you.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.